It seems like these days everything is in the cloud. That has become the coin phrase of the century. And today I'm here with a very special guest, Dr. Gary Levy, who is here to talk about how to put fertility in the cloud. This is such a novel opportunity, especially given everybody's under quarantine across the world. You go by Dr. Gary. I want to start with understanding what drew you into the field of reproductive medicine in the first place.
Hi, Alice. Thank you so much for having me. I really appreciate you taking the time for me to come on and discuss this amazing opportunity for everyone. Well, to be honest with you, when I went to med school, I knew I didn't want to be an OBGYN and I knew I didn't want to do internal medicine. And then when I did my OBGYN rotation, there were no other medical students there, no other residents. It was just me, the attending. And so I thought that was actually pretty cool. And it was the only rotation where I got up and I drove to work and I didn't really mind getting up in the morning. So I thought, well, that's going to be a natural fit. All right, take it for what it's worth. And then after residency, when you start getting exposed to different subspecialties, I really liked the intellectual aspect of REI. There was a lot of decision making that has to go on. And there really isn't a lot of established dogma. You really have to interpret the evidence yourself and make decisions yourself. And so that autonomy drew me into reproductive endocrinology.
That's amazing. There are highs and lows, though, to being in this field. You know, highs of success and lows of failure. So talk to me a little bit about what your experience has been like being an IVF doctor and kind of weathering all of that with your patients.
Yeah, well, there is no question. You have to be even keeled in this field because no matter what you do, you're going to have to face failure, no matter how successful your practice is. So it's important for you to have an understanding of how to get your patients through this process. And I think it's an acquired skill, but it's a skill that is probably just as important as your clinical competence, because ultimately you're going to have success, but not at first and not all the time. And so that process is one of the most important things, and I think ultimately one of the things that also draws me to this specialty as well.
Now, what was the genesis of Fertility Cloud?
Well, the genesis of Fertility Cloud was a process. So I initially had this idea back in 2015, but at the time, it really didn't materialize just because I was busy getting board certified and doing the traditional brick and mortar practice. And then about a year ago, I started talking to my partner, and he floated the idea of developing a practice that could be completely remote. And I thought about it and I said, well, there's a lot of patients that, you know, we do a lot of teaching, we do a lot of consultation, we do a lot of lab work. They don't necessarily need me to put my hands on them. Right. And so that generated an idea where we can do everything through telemedicine to include the consultation, the laboratory testing, and then some of the treatment, all without making the patient leave their house. And I thought it's a great opportunity because it tremendously improves access, and it tremendously improves access. And as you know, the data demonstrates that there's a significant number of patients who never get to see a fertility specialist or has to wait to see a fertility specialist. And what we offer is an opportunity 24 hours a day, 7 days a week, and now almost anywhere in the country, you can pick up the phone or open the computer and talk to a fertility doctor, have a consultation, and if you're the right patient, you can have a full evaluation over the internet. Everything gets sent to your house, and you can even be treated with medicines that come directly to your door.
I think this is so incredible, and you had the idea for this so much earlier than the world was even necessarily ready for it, right? And you and I both actually started our companies kind of around the same time. I mean, the genesis of the idea for Fertility Answers was in 2016, and yours was 2015. And now, because of COVID, because of quarantine, because of these new times that we're in, both patients and providers are now willing to do this kind of care. Now, somebody can't do a remote IVF cycle, but as you're suggesting, and as we know from the data, far more patients don't get in to see a fertility specialist than do. And one of the things that I love as a patient advocate about your model, Dr. Gary, is that you are all about practicing for specialty fertility healthcare, and that you're not so completely attached to the IVF cycle happening or not. You really just want to reach the millions of people who haven't even had one consult yet with an IVF doctor.
That's correct. And the breadth of fertility medicine is significantly more than just IVF. Now, granted, yes, at this point, we cannot do an IVF cycle in the cloud, but yet, exactly. But we can certainly do an evaluation, a comprehensive evaluation. We can certainly do a lot of the blood testing that regular fertility doctors do in their office, all in the comfort of your home. And there's a significant plurality of patients that are not going to need an IVF cycle. And so those patients we can definitely also treat by delivering the medicines directly to your home.
When one of the first times that we talked, when I first met you, I said, but what about the HSG? You know, and you mentioned that there's alternatives to an HSG, that doesn't always have to be the very first thing that you do to check if somebody's tubes are open.
Absolutely, absolutely. Now, we certainly, during the consultation, we will screen whether or not somebody is at high risk for having a tubal blockage, right? And HSG is ultimately one of the gold standard testing for tubal obstruction. But if somebody is at low risk for having a tubal obstruction or tubal disease, doing antibody testing for some sexually transmitted infections is almost as good. And if those are negatives with a low risk history, a lot of patients can avoid having a painful and uncomfortable and a lot of times unnecessary and expensive procedure and be treated empirically.
That's incredible. I would have loved to have skipped mine. I remember, I mean, there are certain diagnostics that stick into your memory, whether it was from the days of a cancer patient or as an infertility patient. And HSG is one of them. We get a lot of questions on the Fertility Answers app actually about them. So I love hearing that, you know, there's other ways to triage someone. There's other ways to kind of go through. How long is that first appointment with you usually? So we can set proper expectations. If someone does book that initial consult, how long is that first conversation going to be?
Well, it really depends. We put aside an entire hour to have a conversation that explores the medical history, explores any risk factors for any fertility disorders or any reproductive disorders. We actually send out an initial questionnaire and a template and essentially a brochure that explains a step-by-step process of what you should expect when you receive your fertility care with us in the cloud. And once you obtain your consultation, it could be the entire hour, depending on how much history we need to obtain and how much teaching we have to do, or it could be, as quick as 15 minutes. Again, it all depends on what the patient requires.
Sure.
Now, it doesn't have to be an initial consultation. Sometimes it's a second opinion or a records review for reassurance, or again, for any kind of second opinion or additional information. But traditional initial consultation, like anywhere else, will take about an hour.
Got it.
It sometimes takes a little bit longer because people are not used to seeing their doctor through the computer. But I think with the current environment, the paradigm is shifting, and people are going to probably prefer to see their doctor this way, especially if they don't have to leave the house.
I think so, especially for the first consult. You know, we've been advocating for this for years. And you know, Fertility Answers itself is a telehealth platform, and our telemedicine portal will be live here shortly. But I really do believe that we can actually reach far more patients if the providers are willing to do telemedicine visits this way through the computer. You know, and you don't have somebody knocking on your door to say your patient's waiting in the next room, but I mean, I think that the emotional benefit of a patient's first visit, not having to be in a waiting room, uncomfortable waiting room, not have to deal with parking, not have to deal with traffic. There's so much stress, not having to deal with taking the time off, quote unquote, from work, because it's the driving time away from work, plus the parking time, plus the visit time, plus the driving back. There are so many things that we eliminate that make that first consult, I think, more stressful than it really needs to be. And then there's that whole kind of emotional, angle of a patient is sitting there wondering about the other patient sitting across the room. And if you have an egg freezing patient, they're mixed up with infertility patients, which nobody loves. Or you might have an, emergent cancer patient case, and they're wondering, is everybody looking at me? And I think there's so many different scenarios where the first visit being at home is just such a wonderful opportunity and a game changer for our field in the right direction. So I do want to just thank you for being willing to do this.
Oh, absolutely. I mean, like I said, I think this is the current crisis. If it has a silver lining, it'll kind of adjust the paradigm to how people obtain their medical care. And it doesn't have to be from home. I mean, you can have patients going out to have their coffee and sitting in a coffee shop and talking to me. And I completely agree with you. Like, there's a lot of these intangibles that we don't really think about, but we've completely eliminated. You don't have to interrupt your professional schedule. You don't have to interrupt your social schedule. At this point, with the suspension of licensing requirements, we can do telehealth appointments for anyone in the country. Once the licensing requirements are going to come back, we will be able to do this for patients in 23 states. And then our aspiration and our goal is to be able to do this again nationwide and 24 hours a day, 7 days a week. So if you have an abnormal schedule, we can do this for you at any hour, day or night.
The other intangible is how complex sometimes it is to get a couple on the same schedule, right? To both get the time off of work or both show up. And I'm wondering in this model, if you expect there to be more, initial consults with two parties available, and maybe we'll see kind of faster booking because it's just easier. It's almost like the shift in using a frozen egg donor versus a fresh egg donor. If you don't have to coordinate everything with as much difficulty, then we could expect, better compliance or better uptick, right, of utilization.
Absolutely. Absolutely. I think this allows the flexibility for couples, for single women, for single men to obtain a consultation at any time, again, without interrupting any of their professional or social schedules. Don't have to take time off from work, don't have to take away time from your family, from your friends. Do it at your convenience.
That's right. Now, there is an important element too that I think, is also just a huge benefit of this, and that is at-home sperm collection kits. Now, this is something that has long since been a difficult part of the process for men to have to go into a clinic to provide a sample. And I can't speak for men, I'm just speaking from the feedback that I've gotten from working in the sperm bank industry for many years. So talk to us a little bit about that, is that when you do an at-home collection kit for the semen analysis, is it mail-in? Is it couriered in? Is it going to your HQ practice, or is it going to kind of a local lab partner? How does that process work?
Well, we've partnered with one of the premier collection and sperm banks in the country, and they will FedEx the home collection kit to the patient with all of the instructions. The patient then collects at home, following the instructions, and then ships it back to the centralized facility. So no, we have partners that are going to, absolutely. We've partnered with the very premier lab corporations and sperm analysis corporation and pharmacies that's going to provide top-notch fertility care, again, in the comfort of your own home.
Was it you that came up with the name Fertility Cloud?
Actually, it was my wife.
I love it. I think it's fantastic. I mean, truly, it's one of the phrases of the century, right? Maybe even beforehand. I think
we'll see.
We'll see how it goes. But I'm an advocate. I'm a huge fan. I think that this is the future for everyone to increase access to care. Brick and mortar has been the traditional way of doing things. And certainly if someone needs an IVF cycle, you will send them to, a referred physician where they can still access that care. But the thing that I'm so passionate about that you're doing is that there's literally 7 million people who need access to a fertility specialist who in the old model was not really accessing care. And the more people that are willing to do telemedicine visits, then the more people we're going to reach. And that
Yeah,
delights.
there's absolutely no question. Yeah, there's just not enough of us to go around.
It's not. I keep
Yeah,
telling everybody
absolutely.
that. I
And, you know,
can't,
and
we don't graduate enough fellows,
mhm.
right?
And
We don't.
yeah, absolutely, yeah. And so what we're doing is multiplying essentially the number of patients we can see. And so our mission and our vision is that everyone has a consultation with a fertility specialist at their convenience, without the wait, without the headaches of going through the struggle of finding someone, driving there, parking, and taking away the anxiety and the issues associated with everything of obtaining fertility care.
I do also want to kind of stress for everyone, this is an incredibly affordable way of going about specialty fertility care. There's a lot of people concerned with the price tag of an IVF cycle, a lot of people who are looking for medical tourism options to pay for an IVF cycle, but this is an option to see if you even qualify for this type of specialty fertility care prior to embarking on an IVF cycle. So I would just encourage folks to look at it like that, any investment you make in this could actually end up saving you $20,000, $30,000, $40,000 later, if you can optimize your fertility and actually get this type of a fertility treatment.
Absolutely, yeah. The prices are all listed on our website, extremely affordable. Everything's included. We have packages. Depending on what the triage during a consultation entails, we think that you're going to require. And then there's even packages for empiric treatment for low-risk patients that are incredibly affordable. So I strongly encourage people to utilize the service, just because I think we're transparent, we're increasing access, and we're allowing fertility care to come into your living rooms.
I love it. I love that tagline so much. So before we wrap up, I also happen to know that you're a father yourself.
I am.
What has that been like for you? What does it mean to you to be a father?
Well, I have 3 kids. So I have a 15-year-old, then I have a 9-year-old, then I have a 10-month-old, right? And I have, 2 older boys, and then a brand new girl. Aww. And full disclosure, my wife really wanted a girl, and we did IVF to have a girl. And so I'm intimately familiar with everything that our patients go through.
Wow.
But what I found is that, every one of them is very different, but it's a tremendous responsibility, but it is the most incredible blessing in life. And it's an absolute privilege for me to provide that for my patients. I couldn't see myself doing anything else.
Me either. I might have gotten to the fertility field by way of a cancer diagnosis, but I think reproductive medicine, no matter what area that you touch, is such a calling. It really is. And, I love being a mom more than anything on the planet. Through all the hard things, all the milestones, you used to say, like, all the dirty diapers, all the sleepless nights, if that's the dream that somebody has for their life, we will help them get there.
Absolutely.
I love how aligned we are, on that mission and that vision. I thank you so much for your work, Dr. Gary, and for Fertility Cloud and for this company. You will be able to find all the links to his offering on the website. We will include those links in the comments. You can find us on YouTube, on Instagram, on Facebook. And if you need to ask any questions, then certainly you can access the Fertility Answers app. Dr. Gary, best of luck. We will do whatever we can to get the word out about Fertility Cloud. Thank you so much for being here.
Well, we really appreciate your time. Thank you so much, Alice.
All right.